بسم الله والصلاة والسلام على رسول الله. معكم أخوكم رمز الآجم، أستاذ مساعد بقسم العلاج الطبيعي بجامعة جازان. اليوم راح نتكلم عن موضوع مهم لبعض الأخصائيين، خصوصا اللي شغالين مع حالات الأعصاب. راح نعطيكم نبذة بسيطة عن Spasticity after spinal cord injury. في البداية راح نتكلم بشكل عام عن Spasticity. راح نذكر definition, الباثيوفيسيولوجي and incidence and the pros and cons of spasticity. بعد ذلك راح أتكلم عن the most clinical assessment of spasticity. في النهاية راح أتكلم عن الطرق العلاجية وراح أركز على دور العلاج الطبيعي. What is spasticity? Spasticity is velocity dependent increase in muscle tone. This appears as exaggerated tendon jerk, clonus spasm. لازم نعرف نفرق بين الspasticity والrigidity. Spasticity is velocity dependent. الrigidity is velocity and independent. ايش مقصود velocity independent و velocity independent؟ velocity independent معناه ان الspasticity تعتمد على السرعة. إذا سويت slow passive movement ما راح تظهر معك، بس إذا سويت fast passive movement راح تظهر معك الspasticity. الrigidity تظهر معك سواء في slow passive movement and fast passive movement. زي ما ذكرت spasticity can be triggered by a fast passive movement, and it's one component of upper motor neuron lesion. And the upper motor neuron lesion usually occur above the anterior horn cell of spinal cord, including the spinal cord, brainstem, and brain. Any injury in this location will cause upper motor neuron lesion sign, and the spasticity is one of the signs of upper motor neuron lesion. What is the reason for spasticity or pathophysiology? We know that the brain controls the body movement, and these movements are generated in response to a stimulus. However, sometimes there is a need for a quicker response. So spinal cord is responsible for this quick response, and this is called the reflex. These reflexes are protective, for example, the withdrawing reflex or arc reflex is responsible for a simple movement or responsible for a quick response movement. For example, the reflex of the drawing of the hand when you touching the hot object. Like when you touch the hot object, suddenly you do a quick response, and this usually is generated by the arc reflex or withdrawal reflex. This usually in healthy human, and this reflex usually inhibited by the signal is coming from the brain. So this inhibited signal will prevent any continuous contraction in the muscle. يعني إذا صار الارc reflex مثلا you touch a hot object and you do like sudden biceps flexion, and then the brain will send, in healthy individual, the brain will send inhibitory signal to inhibit this movement, to inhibit any continuous contraction in the muscle. This in healthy individual. However, in a spinal cord injury, there is a loss of communication between the brain and the spinal cord. Like the signal, the inhibited signal that is coming from the brain will not reach to the spinal cord due to the injury. Therefore, the muscle will be in continuous contraction due to loss of inhibitory signal that is coming from the brain. Like for example, any external stimulation like passive stretch or touching in the spinal cord can trigger and sustain unwanted muscle contraction. Like if you do a sudden passive stretching in the biceps, this this stretch will cause muscle contraction. So this will cause a muscle spasm. This in an individual with a spinal cord injury. However, in healthy individual, like if you do passive stretching, the brain will send inhibitory signal to the, for example, to the biceps muscle to allow it a muscle to be stressed. I'm gonna explain it again. Like in spinal cord injury, as you see in the figure, if you do a passive muscle stretching, this will act. The muscle spindle will send a signal to the sensory neuron. The sensory neuron will send a signal to the motor neuron, and this will lead to contraction in the muscle. This an individual with spinal cord injury. In healthy individual, if you do a passive stretching, the brain is gonna send a signal to stop this signal from coming to the motor neuron, so you can do the passive stretching easily without any this will not trigger any muscle contraction. So we can summarize the pathophysiology of spasticity in spinal cord injury as loss of inhibitory descending signal in the spinal reflex. There's no inhibitory signal coming to the brain in the spinal cord. Hyperactivity of stretch reflex that are mediated by muscle spindle stretch receptor, and reduce the activation of threshold for the muscle unit and increase the response to stimuli. After spinal cord injury, usually the motor neuron will be in the period of spinal shock, and this manifested by flaccid tone. Like after the injury, the muscle will be in flaccid tone, and there is also absence of deep tendon reflex below the injury level. And spasticity usually appear after spinal shock resolve. Like this will take maybe several weeks or several months to begin to develop spasticity after injury. And it's reported that 65 to 75% of individuals with SCI will suffer from some degree of spasticity during their life. And it's more common in people with higher level of injury and those with cervical and upper thoracic injury. And the incidence of spasticity is less in those with lower spinal cord injury, like in those with lower paraplegia. Also, there is a correlation between spasticity and the completeness of injury, and those with complete injury have more incidence of spasticity. What can trigger unusual response of spasticity in people with spinal cord injury? Like any sudden stretch will cause spasticity, initiating the body movement, any painful stimulation below the lesion level, urinary infection, full bladder and constipation, pit sore and tight or uncomfortable clothing, fracture or muscle or tendon or ligament injury. Now I'm going to talk about the pros and cons of spasticity, and there is some advantage of having spasticity, especially in those with mild to moderate spasticity. And it can be used to trigger the muscle contraction, to do weight bearing activity or transfer. Like some people with SCI will trigger the quadriceps to to help him during standing. Also, spasticity helps to reduce the osteoporosis, like people with SCI are at risk of bone loss due to an ability to do standing or walking, and there will be at risk of loss of bone. And muscle spasticity or muscle contraction can help to reduce the rate of bone loss after injury. Also, it's helped to reduce muscle atrophy and prevent DVT. On the other hand, there are some harmful effects of spasticity. It can affect the body posture, also the sitting stability. Also, it can interfere with daily life activity and personal hygiene, and due to the energy cost of the movement. Also, it can interfere with the breathing, especially those who have tightness in the chest muscle. Also, it can affect sleep due to pain or discomfort. And the complication of spasticity include contracture and skin breakdown. Now I will talk about the clinical assessment of spasticity. I will talk about the most common clinical assessment that are used to evaluate spasticity. And these assessments are a modified Ashworth scale, Third scale, and modified spasm frequency scale. Modified Ashworth scale is the most commonly tool that is used to evaluate spasticity, and it has 6-point scale from 0 to 4. 0 indicates no increase in muscle tone, and 4 is affected part is rigid, inflection, or extension. And there is some grade in between, like 1 indicate slight increase in muscle tone and manifested by catch and release, +1 slight increase in muscle tone manifested by catch and followed by minimal resistance throughout the passive range of motion. 2 like remarked increase in muscle tone throughout the range of motion, but the affected limb can be moved easily. 3 is considerable increase in muscle tone and passive movement is difficult. Third scale is another tool used to evaluate spasticity. However, it requires a longer time for clinician and patient. In third scale, the movement of spasticity is performed at different speed, like V1 at slowest possible, V2 speed limb under the gravity, V3 is at fast rate, like we'll do the fast passive movement. And the clinician or the physical therapist is gonna score the spasticity from 0 to 4. 0, no resistance throughout the passive movement, and 4 is unfatigable clonus, occur at precise angle for more than 10 seconds. And also you're gonna measure the angle at like R1. It means that you the angle of catch you see at the fast movement or the movement during the gravity pull. And R2 is the full range of motion the full range of motion achieved when the muscle is tested at the slow movement. And to get the angle, you have to subtract R1 from R2 to get the angle. Spasm frequency scale is another tool that is used to assess spasticity, and it's self-reported questionnaire that filled by the patient, and it's required and it's measured like the number of spasm over 1 hour period. Like the patient is gonna check from 0 to 4, his frequency of spasm, like 0, he has no spasm during the day, and 1 is mild spasm induced by stimulation. 2 is infrequent spasm occur less than once per hour. 3 is spasm occur between 1 to 9 times per hour, and 4 is spasm occurring 10 times or more per hour. And after that, the patient is gonna check the severity of spasm from 1 to 3. 1 is mild, 2 is moderate, and 3 is severe. Now we'll talk about the goal of the treatment. The treatment of spasticity is multi-dimensional therapy, and it's require collaboration between physician, nurse, and physical therapists and occupational therapists. The treatment should be based on the factors such as the interference with spasticity with function and pain and sleep and complication associated with spasticity. And spasticity treatment include the physical therapy management, oral medication, uh, prenatal medication, and surgical procedure. And usually the spasticity treatment begin with physical therapy and oral medication for optimal management. If the oral medication are not effective or not tolerable by the patient, the prenatal medication will be considered. Like some patients will have some side effects from oral medication, will cause a relaxation in all muscle in the body. However, the prenatal medication or the injected medication, the physician is going to inject the medication in a specific muscle, or is going to inject the medication in cerebral spinal fluid. This will prevent any maybe side effect of oral medication. However, the surgical procedure will usually consider if the other procedure is not effective, or, especially in those with severe spasticity. في المحاضرة هذه راح أركز على دور العلاج الطبيعي في معالجة الspasticity. The physical therapy management for spasticity include prolonged passive stretching, splint, cast or orthotics, positioning, and physical therapy modalities. Prolonged passive stretching help to produce a short-term reduction in spasticity and should be included into the daily living of individual with SCI, and should be also applied several times throughout the day, like should be applied in the morning, afternoon, and evening to get the benefit of a stretch. Also, heat might be applied before the stretch to help to reduce the muscle tone and increase the pain threshold. Also, the splint or orthotics can be used to help improve the effectiveness of muscle stretching. After you apply stretching, you will after you do the stretching, you will apply the orthotics in the limb to keep the limb in the stretching position, and this will help to reduce the stretching reflex and produce relaxation for spastic muscle. Positioning also can help to reduce spasticity. Muscle tone can be affected by the position of the head and the body, and some people with SCI have shown decrease in spasticity with crimping position. Also, proper lumbar support in wheelchair and avoiding sacral sitting can help to decrease spasticity. Weight-bearing exercise such as standing, walking in the treadmill, or overground can reduce spasticity. Like you may use the standing frame or tilt table to do standing. This will help to reduce spasticity in the lower limb. And also, there is many studies have shown that the effectiveness of weight-bearing exercise in reducing the muscle tone and spasm in SCI population. Physical therapy modality such as thermotherapy or cryotherapy also can be used to decrease spasticity. And thermotherapy can cause a muscle relaxation, also decrease the gamma afferent fiber activity, which would lead to decrease in impulse from the muscle spindle. And it should be applied for 15 to 20 minute period to passive stretch. Cold application of a spastic muscle for 20 minutes can help to decrease spasticity by reducing the sensitivity of muscle spindle to the stretch. Other modality of physical therapy is functional electrical stimulation. And applying stimulation over the antagonist muscle of spastic group can reduce spasticity through the reciprocal inhibition. What I mean by reciprocal inhibition is the relaxation in the muscle in one side of the joint while contraction the muscle on the other side. Like for example, if you do a contraction in the triceps muscle, this will cause a relaxation in the biceps muscle. Like and thank you all for your listening, and for any question please send me an email. And here are the references that I use in this presentation.